Welcome everyone to this session providing information about the Monash Medicine course. My name is Associate Professor Deb Leach and I'm one of the co-directors of the clinical years in the course. So I'm going to give you a little bit of information about what to expect and how the course is arranged. So this is what's going to be presented today, the course overview, then some information on clinical placements, study pathways, both direct and graduate entry, the support that's available during the course, and the student experience. Before I begin, I would like to acknowledge the traditional owners of the land on which we are all meeting this evening and pay my respects to leaders and educators past, present and emerging. So medicine at Monash is a beautiful course. It allows entry directly from school following VCE, and this leads into a 5-year program. And it's also got the capacity for a graduate entry program. So someone who's gone from school, done a period of study at university and then entered into Monash Medicine. And this is a 4-year course. And both of these pathways lead to the same degree. It's an MD degree. During the Monash program, there are 4 themes.
Sorry, Deb, to interrupt. Your slides aren't changing. Like they're not moving to the next slide.
Oh, sorry. I will fix that, sorry.
Thank you.
It's saying the screen sharing is paused, but I'm not quite sure why. I'm going to stop sharing and then I'll share again. Can you see that now?
Yes, perfect.
And are they moving?
Yes, perfect. Thank you.
Okay, I'm just going to go back to the start. So this is the slide that I was just talking about the direct entry and the graduate entry to the program. And I'm moving on now to a bit more of the content of the course and how it's organised. So through the whole of the 4 or 5-year program, there are 4 themes that go all the way through these programs, and that's how the curriculum is sort of organised. Theme 1 is about personal and professional development. Obviously, as medical professionals, we need to develop very much a professional persona and dealing with patients and becoming that person who is a doctor. Theme 2 looks at society, population and health and illness. So looking at the way that health is delivered, about population health and things like that. Theme 3 looks at the scientific basis of clinical practice. So this will be the types of topics that you typically imagine associated with medicine, sort of study of anatomy and physiology and pathology, pharmacology, how drugs work. So this is a scientific basis of practice. And theme 4, clinical skills. So how do we actually learn those skills of doing procedures and taking a history from a patient, all of those skills that we need to practice medicine. Now, I'll talk a little bit more about the direct entry from school. So as I talked about those themes, they go across all the years of the course, but now I'm going to go into what's encapsulated in each year level. So campus-based for the first 2 years of the course, and year 1 really looks at a foundational year in basic sciences, so looking at anatomy, physiology, biochemistry, pharmacology, social sciences and population sciences. And this is undertaken on campus with these big foundational topics taken. Year 2 continues with Foundations in Basic Sciences and builds on this. So looks at some more social sciences, population sciences, clinical skills, community and engagement. So looking, building on Year 1 and continuing along with all of these topics. The next 3 years are based with patients in hospitals or in community clinics and other clinical placements. So Year 3 is really that starting year where you're starting to see patients, you're attached to a particular health service or hospital, and you're getting stuck into applying all of the information that you've learned in Year 1 and 2 into clinical practice. So big chunky topics in medicine, in surgery, looking at pathology. So when the body goes, diseases happen and the body has to respond to that. And again, looking at the population health and also research methods modules. So starting to become that, getting some information about research and how we discover new things and how we actually can progress the area of knowledge in medicine. Year 4 is about these topics: general practice, children's health, women's health, obstetrics and gynecology, and psychiatry. So these are 4 very big topics that are undertaken in Year 4 as each one will take up a whole rotation. Year 5, so this is final year, is really preparing for practice. So it's almost could be considered like a pre-intern year where you undertake 6 rotations. There's medicine, surgery, a specialty rotation of something that you might be interested in. Aged care, so looking at the older members of our population and illnesses that affect them, and emergency medicine. There's also a rotation designed for a scholarly intensive project, which gives you the opportunity to do some research and get stuck into a small project of your own with a supervisor. This is very much a year where we also look at patient safety, and you do quite a lot of simulation and simulation-based scenarios to prepare you for all sorts of things that may come your way in internship. So learning in the preclinical years is done largely in classrooms, but it might be small groups or large groups. And there's a lot of interactive work. It's not sitting in lecture theatres just being lectured at. It's very much interactive, innovative ways of teaching and use of innovative teaching spaces. Preclinical learning, we often think about anatomy in the human body, but it is very much around learning how does the body work. And some of you may have done biology in your VCE, and this is really building on those sorts of concepts that some of you may have covered, but building on it and extending it further. So really, how does the body work? Anatomy teaching sounds like a lot, 325 hours of anatomy learning. Some human dissection, looking at amazing 3D print models, looking at some lectures, and the teaching is outstanding. The spaces that are used for anatomy are amazing. You can see in the cabinets at the back, the dissections and the 3D printed models, and the ability to show exactly what the human body is like under the surface is really exceptional, and people absolutely enjoy anatomy learning. Learning in the clinical years, you can see here the Monash sites are very widespread. So we have Monash Medicine in Malaysia, and we've also got this red dots representing the School of Rural Health. So there's a clinical school in Mildura, in Bendigo, and in Gippsland. There's various sites. And then we've got also, I'm not sure why they're not showing up, but the School of Translational Medicine, STM, which is basically Alfred Healthcare, Eastern Health Clinical School, which is Box Hill, Maroondah and Angliss, and we've got the School of Clinical Sciences, Monash Health. So these are all the areas that are utilised to teach students, and it covers a huge area throughout Metro Melbourne and also rural. Learning in the clinical years are learning in the wards from health professionals, learning from the team, and of course learning from patients. And it's often the patients that you speak to that have the most long-lasting impression on you. I still remember the first patient that I ever took a story from as a medical student. And that teaching and learning in the wards is supported by formal teaching in many ways. So there are workshops and tutorials and skills sessions that are all provided in the health service that students are attending their clinical placement. You can see in these photos the different types of activities that are going on. So in the top one, there's a small group tutorial. It looks like a clinical skills tutorial happening. And the middle one, the student is with a tutor at the bedside and is doing some physical examination tuition. And down here in the lower one, there's another clinical skills. It looks like they might be learning how to suture. Learning in clinical years, so year 3B, as I said before, it's really about learning the basics, how to take a story from a patient, how to interact with patients. And you can see in the lower photograph a group of students. It's obviously in COVID times, and they're talking to a patient. It looks like a simulated experience there. And in the upper diagram, there, in the upper photograph, they are in theatre, so students are actively encouraged to attend theatre, to scrub in and to get experience with surgical staff in theatre. Year 4C, we see students undertaking the 4 big topics, the paediatrics, learning how to handle a child, how to look at a neonate or handle a child. And in general practice, of course, so many different presentations occur and students can learn from multiple different patients in general practice and be able to practice those consulting skills with a GP. In year 5D, we have, as I said, a lot of emphasis on patient safety, and some of this will involve going to a simulation lab or sim lab and practicing procedures. And here students are practicing some basic life support as they manage an emergency scenario together. There's also the possibility of some interprofessional learning throughout the course, and I'm actually teaching this week on an asthma interprofessional learning opportunity with Year 2 students and pharmacy students. So throughout the course there are these opportunities to learn with other health professionals all the way through to final year, and these are very popular sessions that we run. There's also a lot of near-peer teaching where the wonderful more senior students will take on a small group of a junior students and teach, and that's always most appreciated by students. Gaining in clinical confidence, it can seem quite daunting at first to move through the course, and particularly that transition zone from the preclinical, where you're more on campus learning in a traditional university style, to moving into the clinical environment where you're learning in hospital settings, can be quite daunting, and it's only natural that there is a stepwise progression of confidence as the years go on. So Year 3B is a major transition, and we provide a lot of support during orientation and some pre-orientation activities to really ease this big jump into the clinical world. So as the years go by, we find that by year 5D, students have become quite confident. They know what to expect in placement. They know how to conduct themselves. And Monash medicine students report that they are very well prepared, probably more so than most other universities, feel very well prepared and confident to start their internship the following year. Research is emphasised throughout the course. As I spoke about before, in Year 5D there is a scholarly intensive placement, and also there's opportunities to undertake a year-long BMed Sci research year. There's a lot of support during the course. We recognise that it's long. There's a lot of academic information and professionalism expectations, and students need support to manage their daily lives and their aspirations and goals and their development of their professionalism and their academic progress as well. So there's a lot of support offered within both the university at faculty level and in the clinical schools. We've also introduced a new support mechanism this year, which was a webinar for family and support people who are supporting students through the course. And this is an optional offering at the start of the year to provide information about the course. It's not all about academics and professionalism. There's also offerings to enhance one's own life. So if students are interested in orchestra and musical things, choir, there's the Monash Medicine Review, which brings out a lot of acting and comedy talents. There's an extremely active Monash Medical Student Society, MUMIS, and they do a whole range of amazing work, and including liaison events with staff. There's special interest groups, so students who are particularly interested in a theme such as surgery or emergency and critical care get involved with some extracurricular activities with tutors, and these are always really popular as well. So the ideal ingredients to be a medical student. There's a list here, and I think being interested in people and curious about what makes people tick, whether it's the illnesses or whether it's the way people think about things and the things that can go wrong with the human body or the human mind. This is a real key ingredient. You've got to be interested in people. Also interested in that sort of altruistic way about serving the community or serving the individuals that become sick. Obviously, an interest in health and science and technology is really key, because these are the types of tools that we're going to be using, technology and science. It's a pretty full-on course. Sometimes the days are very long, so having some energy about you and having the get up and go to do the study and to keep interested and keep at it is important. I think being the sort of person who can attack the course and maintain that level of enthusiasm, that level of engagement, and who can step forward and say, hey, I'll give this a go. I might not know exactly what to do, but I'll give it a go. I'll give answering this question a go. So that ability to step up and have a go. And you've got to enjoy studying for life, because you know when you come out of your medical degree, it's not over. I think all the information that I've had to re-evaluate and relearn all through my career, it's enormous. Nothing stays still. It just keeps going, and there's new drugs and new ways of looking at things and new research. It throws up new information. So we've got to be continually updating that database inside our head and be prepared to learn in new ways. I think being a nice person, being a good listener, being a good communicator, enjoying that detective work that comes with medicine, that you want to get to the bottom of this problem that you need to solve for each patient is such an enjoyable part of being a doctor, is enjoying that problem-solving element of it. And willingness to take on responsibility. Once you step into that room and you start talking to that patient, you then have some element of responsibility for what happens next in their medical journey. So willingness to take on responsibility and to be a leader, to set the direction for where this patient will go, and doing that collaboratively with the patient it's such a key thing. So thank you for attending and listening, and I'm going to hand over now to Natanya and Kyle.
Hi everybody, I'm Natanya, nice to see you. Kyle, would you just be able to share my slide if that's all right? Perfect, thank you. Hi everybody. I'm Natanya Disa. At the moment, I'm a 5th year medical student here at Monash. At the moment, I am currently placed in Bendigo for my clinical placement of the first semester. And that's because I'm part of something that you'll learn about, the extended rural cohort, which means that I've done the majority of my placements in a rural area throughout 3rd, 4th, and 5th year. I'm also an interstate student, so I'm originally from Queensland. I moved here to attend uni at Monash Uni, and I've been having a really great time. So Associate Professor Deb Leach has covered a lot of the specifics of the course, so I'm just here to kind of give a bit more of a student perspective on all of it. So as she mentioned, your med school experience is going to be split up into 1st and 2nd year, and then 3rd, 4th, and 5th year for those clinical years. Something that can be a little bit tricky is that kind of transition, number one, from high school into starting university, the preclinical years, and then again that transition into clinical years as well. So I'm just here to chat a little bit more about what that looks like. So in 1st and 2nd year, as Deb Leach mentioned, we've got a lot of classes that happen, a wide variety of classes, different types of learning. As she mentioned, some of those will be dissections, some will be workshops, some will be lectures, and all of it will be quite hands-on. The actual structure of those classes is that it won't be similar to high school where you would have full day start to finish every single day. Your classes will vary from week to week. So there'll be some days where you've got one class, some days where you've got a full day of classes, and throughout that time, you've got your own spare time as well to do some study, take on any extracurriculars you're interested in, and also just to live your life, social life, family, personal passions. So you've got plenty of time to take on all of those things as well. In time when you move on to your clinical years, similar sort of things. So you've got those classes, won't happen every single day and won't have a strict sort of structure to them. And you also have time to do your own self-study, do your own personal passions. But on top of that, we've also got some time on the wards as well. So during your clinical years, you'll have your placements, and the placements will vary depending on which specialty you're working with. So for example, if you're on surgery, sometimes those surgeries can start quite early in the morning. The ward rounds might start at something like 7 o'clock, 7:30. Whereas a different specialty, something based in a clinic like general practice, might start at 9 o'clock instead. And then when it finishes also depends on the specialty. So as you can kind of see, it is a very different sort of structure to high school. Sometimes it can be a little bit daunting to think about having to kind of, self-direct, but overall it's a really, really great experience. And Monash is also really great with supporting you in each of those different stages of your life and in your medical school career. Overall, I would say that the really tough transition was from preclinical into clinical, I think. I think starting university, while it can be daunting in its own way, I think there's a lot of similarities between university and high school in that way. You're still kind of based around classes, you're still kind of working with your peers in a similar way to you did in high school, whereas clinical years can be quite different, but amazing nonetheless. Another thing I just wanted to chat about is all the different opportunities that are available as a medical student outside of medicine itself. So as you can kind of see on my slides here, absolutely, medicine can be really difficult. It can take up a lot of your time, and there's a lot of different things to study and work hard on. But that does not mean you have to, you know, just spend all your time locked in your room studying the whole time. There's plenty of opportunities to take on a lot of other things. As you can see here, something in the top left corner is I was part of the Monash Med Review that Deb had mentioned earlier. It was such a great experience, and they got to kind of be creative and do some arts and do a lot of work with a lot of people that I wouldn't have been able to work with otherwise, because Monash Med Review involves all the different year levels, no matter where you're placed. There's also opportunities to do things like work as a medic. So recently I volunteered as a medic at the World Superbikes that happened in February, and it was such an incredible experience. I got to work not only with other medical students, but also physio students, allied health nurses, and people actually working in those fields, not just students as well. So that was an incredible experience. And there's also a lot of other things that happen due to the medical society that exists. So we've got different balls that happen, cocktail nights, lots of opportunities to network with other students, as well as doctors, junior doctors and senior doctors who sometimes attend these events as well. You always have the chance to take on something like a research project as well. And that's a really fun opportunity to learn more about something within a particular specialty and work with other doctors to learn something about something you're passionate about. And then, of course, there's also your own just sort of personal things. So, for example, there's a photo of me doing a park run in Bendigo, my first ever park run. And that was a really fun opportunity as well. So absolutely, med school can be a little bit scary, can be a little bit different, and it is a lot of hard work, but there's so many opportunities for you to kind of grow as a person, as an individual, and have a really fun time as well. So that's something to look forward to for you as well. The other thing I really wanted to emphasize is the amount of support that's available in university with all of the big changes that happened. And something that Associate Professor Deb touched on is the kind of relationship between all the different students across the year levels. So something that's been really helpful for me, and something that I'm hoping to do this year as well as a final year student, is kind of to help younger students with everything that I've sort of experienced during medical school. So for example, we have a peer mentoring program. So fifth years can mentor fourth and third years, fourth years can mentor third years, and so and so on. And there's also a lot of opportunities to learn content from senior students as well. So usually at the end of a semester or an end of a rotation, we have some short sort of helpful sessions to help people learn about the content that we've just covered in that semester, but we're learning from students who've been in our shoes before, which I think is such an amazing opportunity and really helped me to understand the very high yield sort of information. And I highly recommend attending any of those sessions once you're in medical school as well. So don't worry, there's a really, really close sort of sense of community between all the year levels, and you learn so much from each other. So that's something, again, to look forward to as well. The last thing I'll just touch on before I wrap up is just a couple of sort of tips and tricks for surviving med school, I suppose. Number one is make sure that you are taking on all the sort of personal things in your life that you would like to. Med school is incredibly important. You're going to become a doctor one day, which is very, very exciting. But make sure you're making time to, number one, look after yourself. And number two, spend time with friends and family and do the things that you love and that you're passionate about besides medicine. And make sure that you're taking every opportunity you can to kind of grow and learn and spend time with the people around you as well, because med school is going to give you so many chances to do that. I also really recommend to try and start developing some study habits for yourself while you're in your senior years of high school. It makes it so much easier once you hit medical school, where there's a lot to study. If you've got some tips and tricks for yourself, everyone's a different kind of learner. So something that might work for your friends might not work for you. But whether you're a visual learner, if you learn from videos, taking notes or doing flashcards, whatever that may be, try to kind of get into the habit of starting that in year 11 and 12. Of course, that'll help with your VCE and your studies, but overall, it'll also help you to get started with some really helpful sort of study tips for when your content will be a little bit heavier in medical school. Yeah, those are just some tips for myself as well. I really, really love medical school. It's been a great experience, and I feel like over the course of the many years, I started off very sort of nervous and anxious because I, felt a little bit like a fish out of water. But overall, as the years have gone by, as Associate Professor Deb mentioned, I feel like I have learned so much and become so much more confident. And now as a final year student, definitely still, trying to figure things out and trying to learn as I go. But I really, really enjoyed my time in medical school, especially as a rural student as well, which I think you'll learn a bit more about as we continue our session. But yeah, I highly, highly recommend Monash Uni for med school, and good luck to all of you with your application process. And yeah, feel free to reach out to me on any socials if you have any questions. Thank you.
Excellent. Good evening, everyone. My name's Kyle. I'm the admissions coordinator for the medicine program here at Monash, and I'll be talking you through the admissions process for our medical program. So before we begin, I'd just like to clarify an important distinction. This slide outlines who qualifies as a domestic student. Beyond the 4 categories listed here, all other applicants are considered international students, regardless of where they're located. This distinction will affect your application process, and we'll discuss that in a bit more detail in a moment. As Deb mentioned earlier, our medicine program has a unique structure with 2 different entry points. What's particularly valuable about this approach is the significant clinical experience that's built into both pathways. Notice, ultimately, both entry points lead to the same medical qualification. In today's presentation, I'll be focusing more specifically on our direct entry program. Now, you might be wondering how many places we have available within this course. The domestic students, we have approximately 234 places. They are all Commonwealth supported. We do not offer fee-paying domestic places in this course. Our domestic places are then subdivided into 3 different categories, and I'll discuss these in more detail in a moment. It's about 134 places for standard school leaver entry, approximately 70 places in the bonded medical program, and another 30 places in our extended rural cohort. We also offer around 82 international full fee paying places. Looking at the specific types of place available for domestic students, we'll start with the bonded medical program. This program, as I mentioned earlier, comprises about 70 places, and they are all Commonwealth supported. This is part of a government requirement that 28.5% of all places must be bonded. To be eligible, you must be an Australian citizen or an Australian permanent visa holder. But importantly, you yourself don't need to come from a rural or remote background to apply. The key feature of this program, and in terms of the government requirements, is that once you graduate, you'll be required to work in an area that the government sees as experiencing a shortage of medical professionals. So you'll be contracted to the government for a total of 3 years for what's called a return of service. Effectively, that's a return of service in response to the Commonwealth place that the government's given you to complete the medicine program. While that's a 3-year obligation, you can complete that over an 18-year period. So you don't need to do it all at once. It is very flexible, and you will be given a range of available work locations to complete that return of service. In addition to the bonded medical program, we also offer another option for students interested in rural medicine through our extended rural cohort. This cohort consists of 30 places, all unbonded and all Commonwealth supported places. You must be a domestic student to apply, but again, you don't need to come from a rural background yourself. As Natania mentioned, what makes this program unique is that students will complete the majority of their clinical learning, so that's their placements, in rural and regional Victoria through Monash Rural Health. This program is ideal for students who are interested in rural medicine and who want to experience living and learning in regional communities. What I want to point out and really emphasise is that while students within this cohort complete the majority of their clinical learning in rural areas, this does not mean that students under standard entry or a bonded place don't also have opportunities to experience rural settings for placement. All medicine students at Monash have the opportunity to undertake rural placement throughout their education. This ensures that every graduate of our program has the chance to experience the really unique aspects of rural healthcare delivery, which is valuable regardless of where you ultimately practice medicine in the future. On screen are the minimum entry requirements for our direct entry course. Note that first point that you must have completed Year 12 within 2 years of course commencement. This means that for those wanting to apply for our 2026 intake, you will need to have completed Year 12 either last year, 2024, or this year in 2025. This is a strict requirement. If you've begun any tertiary study, including at Certificate 4 level or above, you'll instead need to complete a relevant bachelor's degree and look at our graduate entry program instead. We don't accept any course transfers into our direct entry program. Please also note the testing requirements. They do differ. So for domestic students, you'll be required to sit the UCAT Australia and New Zealand, while international students are required to undertake the ISAT. The table at the bottom also shows the specific subject requirements. Please note that only English and chemistry are compulsory for our course. Unlike some courses, we don't require maths or biology as a prerequisite. That will give you more flexibility in your Year 12 subject choices, but we do get feedback from our students that biology in particular does help in that transition to first year, which can be quite heavy in sort of biochemistry learning. Ultimately, it's important to note how you'll be ranked for a course offer. All students are ultimately ranked for offers based on 3 equally weighted components: your UCAT, or in the case of international students, your ISAT score, your ATAR, which includes any adjustment factors, and I'll come to that in a moment, as well as your performance at a multiple mini interview, or MMI. Please be aware the UCAT ANZ test format has changed for this year. The abstract reasoning subtest has been withdrawn. This means the new test format for UCAT will comprise now of 3 cognitive subtests: verbal reasoning, decision-making, and quantitative reasoning, in addition to a situational judgment test. Each will be scored out of 900 for a total score based on the 3 subtests only, for a total out of 2,700. Note, for those who are aware, Monash will continue to use the situational judgment test, or SJT, as a tiebreaker as required. We have several pathways designed to promote diversity and equity in our program. These schemes reflect the university's commitment to building a medical workforce that represents the full spectrum of society. What's particularly noteworthy about many of these pathways is that they aren't simply alternative admissions pathways. Many also come with dedicated support structures throughout your medical education. As an example, our Indigenous Student Access Scheme connects students with mentors and cultural support networks that continue throughout their study with us. Just note, of the access schemes on screen here, only the Elite Student Athlete and Performer Entry Scheme and Cs award ATAR adjustments. So, coming to Cs, detailed on this slide, Cs recognises that academic potential isn't always fully reflected in your raw ATAR alone. What's particularly valuable about Cs is a substantial adjustment of up to 10 ATAR points. So if you score a raw 85 ATAR, you could potentially have that scaled up to a 95. These adjustments can make a significant difference in a highly competitive program like medicine. You'll see on screen here there are 4 categories in Cs. You can apply for 1 or more categories that are relevant to your situation, as long as each category that you apply to is for a different reason. Note the October deadline at the bottom of the screen is later than the general application deadline for the course, so you do have a little bit more time to gather your supporting documents and apply for Cs if needed. The faculty also operates an entry scheme for rural applicants, the Dean's Rural List. This, again, is a commitment by the university and the faculty to provide access to students from rural and remote areas of Australia. 27% of places are held for students from an Australian rural background. What this means at the end of the day is that students from rural backgrounds aren't competing against students from a metro background for admission. Rural students are only competing against other rural students for admission to those places. To qualify, you must have resided for at least 5 years in a row or 10 years in total in areas classified as MM2 to MM7 under the modified Monash model. You can use the Australian Government Health Workforce Locator to look up your current or previous addresses to see if you meet the requirements for this program. Domestic applicants will be invited to apply for the Dean's Rural List in October after course applications have closed. For any questions about the Dean's Rural List, you can contact our School of Rural Health at the email address on the screen. Now, the MMI, or multiple mini interview. The MMI is a critical component of the application process. All our interviews are conducted online via Zoom. So if you are finishing year 12 and plan to go overseas, go to schoolies, whatever it happens to be, as long as you've got access to stable internet connection, you can undertake the interview. Domestic students will complete 6 stations, while international students complete only 4. Each station will have 1 interviewer, and it presents a unique scenario. You'll have 10 minutes at each station, the first 2 minutes to read the scenario, followed by 8 minutes to respond to a series of questions. Please note, there is no expectation of medical or clinical knowledge. So we're not assessing what you know about medicine. There are no right or wrong answers. Instead, what the MMI is assessing is your personal qualities. Some of those are listed on that second last point here. Please note you can only interview once. So if you apply, don't get in and take a gap year and go to apply a second time, your previous interview performance will be reused. So if you are interested in applying, for international applicants, this slide outlines 2 distinct pathways depending on where you are studying or what year 12 qualification you're studying. If you're completing an Australian year 12 NCEA in New Zealand or the International Baccalaureate in either Australia or New Zealand, you'll need to apply through VTAC, so the Victorian Tertiary Admission Centre, by the 29th of September this year, with interviews held in late November. If you're an international student completing an alternative qualification, you will instead need to apply directly to Monash. Please note there is an earlier closing date for direct applications of 30th of June, with interviews conducted in early July. Please note, for all international applicants, ranking for invites to the interview or the MMI will be on the basis of your ISAT scores only. For domestic applicants, this slide contains application information with the specific VTAC codes that you'll need for each of the available place types I mentioned before. So standard entry, extended rural cohort, bonded. You can preference one or more of these, that's entirely up to you. But what I want to emphasize is the importance of the application deadline. Unlike some university course preferences that can be added throughout the cycle, medicine at Monash requires early commitment. The 2 warnings at the bottom about maintaining your preferences are based on real situations where qualified students missed out on the opportunity for an interview or a course offer. Another note, just with regard to course preferences in VTAC, a common misconception we frequently hear is that you should strategically order your preferences to try and boost your chances of getting a course offer. For example, putting the bonded program first, even if it's not your true preference. This is not how our offer system works. I do want to be clear. We make offers down a ranked list based entirely on your UCAT, ATAR, and interview performance, as I mentioned before. We don't give any advantage to students based on how they've ordered their preferences. So please consider your preferences carefully and order them based solely on your own personal interest. If standard entry is your true first preference, put that first. If you're genuinely interested in our extended rural cohort, put that first. Your preferences should reflect what you actually want in the order that you want them, because that's how we'll consider you for admission. This is why it's so important to be honest with yourself and with us in submitting your preferences about what types of offer you're willing to accept and order your preferences accordingly. So for domestic applicants, here are the key dates for our 2026 intake. These can be broken down into 4 key areas. UCAT, registrations are currently open to sit the test, with testing in July and early August. The second window for sort of course applications sees, as I mentioned before, and the Dean's Rural List, which will occur sort of September, October window. Interviews will then commence from the end of November, and we'll be making offers starting from the middle of January. Please note that these dates are subject to change, so it is best to check back on the Monash website on screen regularly for the most up-to-date information. Looking more closely at our interviews, the following slides cover the key interview dates for our 2026 intake. Interviews will be held in rounds, depending on your residential location and your eligibility for the Dean's Rural List. Again, note that these dates are subject to change. An initial round of interviews will be held in late November and early December for students on the Dean's Rural List, as well as Victorian Metro applicants. Invitation for this interview round will be based solely on your UCAT scores, with the SJT as a tiebreaker only, as I mentioned before. I've also included at the bottom of the slide the historical UCAT cutoffs for these interview rounds in the most recent intakes. Please note these are provided as a guide only. Be advised that the cutoff is a product of supply and demand, and without knowing who's going to be applying to our course this year or what the UCAT scores will be, I do not know, and so I cannot advise what this year's cutoff will be. A second round of interviews for the same cohort, so rural students and Victorian Metro students, will be held in early January. Note that invitations for these interviews will be based on both your UCAT and your ATAR, including those adjustment factors I mentioned before, like Cs. A final round of interviews for interstate and overseas applicants will be held in mid to late January. Again, invitation for these will be based on both UCAT and ATAR. Consolidating all of that information into one table for simplicity, here is the full list of interview rounds for our 2026 intake. Please note, for rural students and Victorian Metro students, common question we do get, there is no inherent advantage to being interviewed in that first round in November, December versus being interviewed in January. Admissions decisions at the end of the day are all based on the same criteria, UCAT, ATAR, and interview, and all offers for that cohort will be released in January round 1 in mid-January. So people interviewing in that November, December round won't get offers before students who interview in the January round. Just to note, about 80% of our interviews will be conducted at the end of that second round in early January. And so we will make about 80% of our course offers in January round 1 through VTAC. All remaining offers will be made in January round 2, as noted here at the end of January, with all applicants considered regardless of when they completed their interview. Be aware, VTAC does operate additional offer rounds in February. Historically, we don't tend to make many offers in that round, and they are really only used to backfill places for students who withdraw quite late in the process. Historically, that's been in the region of sort of 5 students or less. So it's highly unlikely, if you've not been successful in those first 2 January rounds, that offers will be made in February. It likely goes without saying, but looking at the data on this slide, you can see that competition for admission to our medicine program is significant. Last year, we received approximately 3,600 domestic applications. You can see how each stage of assessment narrowed the application pool. What I do want to do is make the point that not receiving an offer for our program is not a reflection on your potential as a future medical professional or on you personally. Every year, many exceptional applicants who would undoubtedly make outstanding doctors don't receive offers due to the highly competitive nature of the admission process and our limited capacity to admit students. The margins between receiving an offer and not are often incredibly narrow. There are many pathways to medicine. I know this goes back some time, but in 2021, Australia had approximately 3,500 domestic medical school places for commencing students. That's 3,500 medical places across the country. This program, our direct entry program, accounts for less than 7% of those. We strongly encourage students who don't get an offer to consider alternative pathways. That includes applying to other medical schools, as well as looking at graduate entry as an option after completing another degree. On that note, this diagram illustrates the specific pathways to medicine at Monash. While we've been discussing direct entry from Year 12, which is the most straightforward pathway, the multiple undergraduate programs shown here provide alternative journeys through to our graduate entry program. Many medical students often find these longer pathways advantageous as they develop greater maturity and certainty about their choice to pursue a career in medicine. That's all from me at this point. I'd like to thank you all for tuning in. There are a number of links on screen here to information about our course, our admission and entry requirements, as well as the key dates for our program. And we do have a range of FAQs online. That also links through to an email address to contact us for anything that hasn't been answered in this presentation or on our website. Thank you again.